Introduction to the Principles of Ethics. Ethics involves 1. Principles and values that help to define what is morally permissible and or impermissible in specific circumstances. And 2. Rights, duties, and obligations of individuals and groups. The practice of medicine assumes there is one code of professional ethics for all physicians and that they will be held accountable by that code and its implications. The physician-patient relationship significantly depends on trust, which is recognized in the concept of fiduciary duty, responsibility of physician towards patient. A fiduciary duty is a legal duty to act in another party's interest. Profit from the fiduciary relationship must be strictly accounted for with any improper profit, monetary or otherwise, resulting in sanctions against the physician and potential compensation to the patient, even if no physical harm has befallen the patient. Important: autonomy versus competence versus capacity. Autonomy, the right that patients have to make decisions according to their values, beliefs, and preferences. Competence, the ability to make a specific decision for oneself as determined legally by the courts. Capacity, the ability to make a specific decision for oneself as determined by the clinicians proposing the specific treatment. The 4 principles approach to medical ethics. Autonomy recognizes an individual's right to make their own decisions in their own ways based on their wishes, beliefs, values, and preferences. It may not be possible for a person to make a fully autonomous decision and or to have an autonomous decision honored in some circumstances. For instance, if an autonomous request for a medical intervention is deemed clinically inappropriate from the physician's perspective, then the physician need not offer it. Autonomy is not synonymous with capacity. Beneficence, obligation to provide benefit to the patient based on what is considered to be their best interests. Consideration of best interests should consider the patient's values, beliefs, and preferences, so far as these are known. Best interests extend beyond solely medical considerations. May be limited by the principle of autonomy, such as when differences exist between patient and clinician's conception of best interests. Paramount in situations where consent choice is not possible. Non-maleficence, obligation to avoid causing harm. Primum non nocere, first do no harm. A limiting principle of the beneficence principle. And justice, fair distribution of benefits and harms within a community, regardless of geography, income, or other social factors. Concept of fairness, is the patient receiving what they deserve, their fair share? Are they treated the same as equally situated patients? Equity, how does one set of treatment decisions impact others? Equality. Equality and equity are different notions of justice. Equality involves providing the distribution of resources to all people irrespective of differing needs, and equity involves distributing the resources in a way that considers differing needs, such as circumstance and social context. Both concepts raise different considerations. Basic human rights such as freedom from persecution and the right to have one's interests considered and respected. Note, the 4 principles approach, that is, principlism, is just one approach to medical ethics. There exist many other ethical principles that are also relevant to medicine, for example, transparency, trust, etc. So the 4 principles here: autonomy, beneficence, non-maleficence, and justice. CMA Code of Ethics. The CMA developed a code of ethics that acts as a common ethical framework for Canadian physicians. The Code of Ethics is prepared by physicians for physicians and applies to physicians, residents, and medical students, based on the fundamental ethical principles of medicine. Sources include the Hippocratic Oath, developments in human rights, and recent bioethical discussions. CMA policy statements address specific ethical issues, topics, not mentioned by the code, for example, abortion, transplantation, medical assistance in dying. Important. The CMA Code of Ethics and Professionalism is a quasi-legal standard for physicians. If the law sets a minimal moral standard for physicians, the code seeks to augment these standards. That's it. Next video, we'll learn about confidentiality.